All right, so worry as festivities are going ahead and India reporting a record number of cases. Over 2,47,000 new COVID cases have been reported in the last 24 hours. That's a 13.11% positivity rate, and the active caseload is currently 11,17,531. Now, this as different directions are coming from the center over the handling of COVID cases. To talk more about India's situation and the protocols to follow, we're joined by Dr. Jagdish De Hiramati, Chairman, Asra Multi-Speciality Hospital, Bengaluru. We're also joined by Dr. Hemant Deshmukh, Dean of KEM Hospital, and Dr. Vivek Nangia, Principal Director and Head Respiratory Critical Care Medicine, Max Sake. Thank you so much, doctors, for joining us. And Dr. Hiramat, first to you, given the rising cases, it's worrying seeing the festival season and the crowds that are out on the streets.
Yeah, there has been no reduction in the number of cases. There is no respite. The number of cases are going on increasing, and people are going on as if there is no tomorrow. They're not trying to take relax a bit and go slow. They're not doing that. They're behaving literally as if there is no pandemic or nothing happening around. Of course, it has been aided by the fact that the number of cases, what we are seeing now, we are seeing a huge jump in asymptomatic patients and incidental positive findings of a lot of people who come in for different reasons. Even in our hospital, patients come in for a different reason, and when we check them up, they turn out to be positive. So there is something else which is happening. I feel that it's spreading quite fast, but the number of asymptomatic cases and the incidental findings are much, much more than what the number is being projected out there. This is
right.
What I feel.
And what would you say about the messaging? Let me take that to Dr. Deshmukh. The kind of messaging coming from the government. Earlier there was something about, not testing. Now they're saying that no, whoever's come in contact must isolate for 7 days. The elderly must be tested, but the youngsters or the children at home need not be tested, but must isolate. So, these kind of directions coming from the government.
Kargi, good morning. What bothers the Indian population is that what causes a spike of Omicron cases right now, and this is effectively to be blamed to the human behavior, that is purely COVID inappropriate behavior of people. You just can't force people to stay indoors. This variant, which is called as Omicron, is highly, extraordinary and unprecedented efficiency that it has. Wants to infect each and every one in the household. If one person in the house gets infected, all others will get infected. There will be nobody in the entire country who may not get infected. But one point of caution here, Gargi, is that this is not common cold. People are realizing that this is just common cold, runny nose, and they tend to go out even after 2 days. The highest infectivity and the transmissibility of Omicron is in the first few days when the RT-PCR or RAT, what we call as the rapid test, is not done. So when you do actually a RAT, the infectivity and the transmissibility have already gone down. So what needs to be done is you do as many RAT as possible, as many rapid antigen tests as possible, and isolate yourself. This is the only way to win over the Omicron transmissibility. And human behavior cannot be either turned or you cannot mend their ways. And the winter months are obviously, fueling this spike in the number of Omicron cases.
That's right. In fact, the center has said that this is a misconception that's spreading, that, it's just like a common cold, but it's not. It is more serious. Dr. Nangia, if you could share with us, what has the experience been so far in terms of the hospitalizations? What are some of the worst symptoms that you're seeing?
Good morning, Gargi, and thank you for asking me this question. I think we are following exactly what is happening in the West also. South Africa had a very sudden spike in the number of cases, and then it started to come down also as suddenly. So we are hoping that we also follow the same trend. While in the US, UK, the numbers are still on the rise. UK has reported some 2 lakh plus cases, which is the highest ever in the entire pandemic, and US has actually broken all records and has reported some 10 lakh cases. So
That's right.
we are also following the same trend. And as far as hospitalization is concerned, the hospitalization rates are also going up slowly and gradually. Not as much as they were in the Delta variant, I would still admit that. But yes, we are heading towards it. And if we don't control our behavior now and cut this cycle of the spread of the virus, then we may land up in a situation where the hospitals are getting overwhelmed. As it is, healthcare workers are getting affected. We are short of staff at times, but we're still managing it somehow. So I think all these things need to be taken into consideration.
No, absolutely. I mean, it's just burning through the population in a sense, this Omicron variant. Dr. Hiramat, if you could, also share with us what you've been seeing in the hospital in terms of, the patients coming in. Also, this time around, and this has been spoken about, we're not seeing that demand for oxygen or oxygen monitoring the way we saw it in the second wave.
Yes, I agree with you. In the initial days, like about a week or so ago, we were not seeing patients requiring oxygen or requiring ICU. But in the last 2-3 days, there is a small trend up. I think this is related to the increasing number of cases. And although the percentage of patients who require oxygen and who require ICU care is much lesser compared to what we saw in the second wave, the requirement is still there. We still have patients who have concomitant other disorders who come up with falling short of their own requirements and needing support. So these are the patients who will require, whom we commonly call as comorbidity, people with comorbidities. So these are the people who are ending up becoming, requiring ICU care and oxygen support. I'm not seeing, as of now, we are not seeing any young patient requiring oxygen like what we saw in the second wave. But we are seeing quite a few number of patients who require oxygen and who require ICU care also. In my own hospital, we have about 4 patients who are requiring NIV.
Right.
So there is a requirement. I think if the numbers keep increasing the way it's gone up in US, if we start touching, let's say 1 million, 2 million, the way it's happening in US, I feel the system is going to be overburdened.
Right, and it's worrying seeing, these crowding and festivities taking place. The Magh Mela tomorrow, you're going to have, lakhs of people taking a dip. Dr. Deshmukh, now we know in Mumbai and other states as well, but Mumbai especially, you have war rooms, you're managing people under home isolation. But the fear also with Omicron is, what do we know so far about it? Because, earlier we've spoken about long COVID. Now with Omicron too, the dangers are even if your illness is mild, you could see symptoms carrying on till later. Also, the infectivity post Omicron infection. Do we know anything about reinfections post Omicron infection?
Exactly, Gargi. What I was always wanting to tell you that Omicron is not a very benign disease. This is not common cold or common fever that you people have been experiencing for so many years back. But the long COVID, that is the after effects of Omicron infection, may be devastating. We really do not know what will happen. There are diseases like stroke, transient ischemic attacks, heart attacks. There are probably transverse myelitis and possibly all kinds of diseases which probably we have seen in the second wave following the COVID. Now this long COVID, last year we saw a lot of increase in the number of diabetics also, newly found diabetics or newly diagnosed diabetics. Luckily for us, COVID this time, the Omicron is not causing any kind of lung disease or lung parenchymal disease. So that is one point which is very soothing, at least for the asthmatics and those who already have a background lung parenchymal disease. But the after effects of Omicron, really nobody understands. But you should understand that this is likely to cause a high thrombotic index of the blood, and which may eventually cause either gangrene, cardiovascular thrombotic effects, or anything which cannot be predicted at this time. Second wave, we did not predict mucormycosis. This time
right.
We don't know whether mucormycosis is going to resurface again.
Right, and those are the dangers. Dr. Nange, anything that you'd like to add to this?
So basically, we still don't know how this will pan out in the times to come. You know, whether long COVID syndrome will happen or will not happen. This is a virus which is very, very unpredictable. And what is also important is that if this continues to soar as high as it is and persist in the ecology, then definitely it is going to further undergo mutation and a new variant may just come up. We have already heard of one variant in France. There's another one which is being worked upon so far. So you never know.
Yes.
We may just, end up having a newer variant within the next 6 months. So we have to break this cycle. That is what I'm trying to say, that we have to curtail our movement outdoors. We have to restrict our gatherings. We have to follow all the COVID appropriate behavior. And more important than that is to get themselves vaccinated. You know, all those people who still haven't received their first vaccination, they go in for the first and the double vaccination. They have to go in for their second vaccination. So there's huge potential of dangers that will be coming in times to come.
Absolutely, and potential dangers is what we all need to be aware about and not treat this, casually, the manner that we're seeing people crowding around. Thank you so much, doctors, for sparing your time and joining us on the program this morning.
Thank you.
Thank you, Gargi.
Thank you.